guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering maternity, but to be more specific, I'm going to be covering postpartum issues. So guys, if you haven't done so already, you know what I'm going to ask you to do. Please do not forget to like and subscribe below, guys. I get emails from you all the time saying how I'm helping you pass your class. Well, if you want to support this channel, the best thing you can do is 1, like and subscribe, and 2, share my content. Please don't forget you can find me across all social media platforms such as Facebook, Instagram, TikTok, and of course right here on YouTube. I have audio lessons available on my website. Soon I will also have testing prep material and study guides. So those are coming soon as well. And you can find that on my website, nexusnursinginstitute.com. Guys, I've seen the emails about the podcast for the RN and the nurse practitioner. I've been so overwhelmed, but I promise I'm coming back. I'm coming back. Just hold on, guys. Give me just a little bit more time. Thank you so much for the support, and let's get started. First question. A gestational diabetic client who delivered yesterday is currently on the postpartum unit. Which of the following statements is appropriate for the nurse to make at this time? 1, monitor your blood glucose 5 times a day until your 6-week checkup. 2, I'll teach you how to inject insulin before you're discharged. 3, daily exercise will help to prevent you from becoming diabetic in the future. Or 4, your baby should be assessed every 6 months for signs of juvenile diabetes. And guys, the correct answer is 3. Daily exercise will help to prevent you from becoming diabetic in the future. Here's the thing. Women who experience gestational diabetes is at a higher risk of developing diabetes type 2 in the future. So it's very important to teach these patients that they're already at risk. So it's very important to diet and exercise appropriately. And when I say diet, not fads, guys, but to eat fruits and vegetables and really food low, not to eat or consume too much foods that are high in glucose, sugars, refined sugars, okay? Now let's look at the other answer choices. 1, monitor your blood glucose 5 times a day until your 6-week checkup. There's no need for that. The woman who has gestational diabetes, she has what type of diabetes? Gestational. So she has it because she's what? Pregnant. But as soon as she delivers, that glucose goes down. We don't have to worry about that. So that's not necessary. Choice 2, I'll teach you how to inject insulin before you're discharged. That's not necessary. The reason she has diabetes is because of the baby that was in her tummy. As soon as she delivers, that glucose is going to go down. It doesn't mean she's diabetic forever. No, it just places her at risk for developing type 2 diabetes. So that's wrong. And then choice 4, your baby should be assessed every 6 months for juvenile diabetes. That's not necessary either. Why? Most kids, I'm saying kids, but I should say children, they don't even develop type 1 diabetes until 2 years of age or older. So there's no reason that we need to be checking the patient's glucose every 6 months. It's not necessary. Okay, that's why number 3 is the correct answer. Next question. Excuse me. A client is receiving a blood transfusion after the delivery of a placenta accreta and hysterectomy. Which of the following complaints by the client would warrant immediate discontinuing of the infusion? 1, my lower back hurts all of a sudden. 2, my hands feel so cold. 3, I feel like my heart's beating fast. Or 4, I feel like I need to have bowel movement. And guys, the correct answer is 1, my lower back hurts all of a sudden. If you have been following me for any amount of time, oh, my hands are ashy. Okay. If you've been following me for any amount of time, guys, you know that all of a sudden is one of those phrases that when you see it, that is the patient that you run to first. Matter of fact, oh, it's too far over there. On my cup that I sell on my website, I have words on there, my coffee mugs. I have words and phrases that kind of clue you in that this is a priority patient, and all of a sudden is on there. When you see all of a sudden, and it's not for the good, you need to be running to that patient. And absolutely, all of a sudden, my lower back hurts all of a sudden. So what are we thinking about, guys? We're thinking about blood transfusion reaction, because that is one of those signs and symptoms of blood transfusion reaction. This is what happens when I speak too fast. Now, choices 2, 3, and 4. Yes, the patient needs to be assessed, but these are not signs and symptoms of a blood transfusion reaction. It's not a priority over that patient that is exhibiting signs and symptoms of a blood transfusion reaction. Next question. A client has just received hemabate carboprose because of uterine atony not controlled by IV oxytocin. For which of the following side effects of the medication will the nurse monitor this patient? 1, hyperthermia, vomiting, and diarrhea. 2, hypotension and respiratory collapse. 3, anasarca and fluid overload. Or 4, palpitations, anxiety, and insomnia. And guys, the correct answer is 1, hyperthermia, vomiting, and diarrhea. And guys, I'd like to add one more sign and symptom we commonly see with this medication, and that's nausea, okay? Choices 2, 3, and 4, these are not signs and symptoms that are associated with this medication, okay? Next question. A client who's 2 weeks postpartum calls the OB nurse and states that she has a whitish discharge for 1 week, but today she is bleeding and saturating a pad about every half hour. Which of the following is an appropriate response by the nurse? 1, this is normal, you're starting to menstruate again. 2, you should stay on complete bed rest until the bleeding subsides. 3, pushing during a bowel movement may have loosened your stitches. Or 4, the physician should see you. Please come in whenever you're ready. And guys, the correct answer is 4. The physician should see you. Please come in whenever you're ready. What are we suspecting? Hemorrhage. This patient is bleeding. This patient needs to be assessed. 1, it's only been 2 weeks. So no, this patient did not start their menstrual cycle yet. It's only been 2 weeks, so that's wrong. Choice 2, you should stay on complete bed rest until the bleeding subsides. As a student, if you choose that answer, what you're telling me is tell the patient to stay in bed until they die because they're bleeding out. So if you tell them just to be on bed rest, they're just going to die in that bed. So no, we're not going to tell the patient that. Next, pushing during a bowel movement may have loosened your stitches. Yeah, there are no stitches in the world that will cause this much bleeding. So that's absolutely false. Number 4 is the correct answer. The patient's hemorrhaging and they need to be seen. Next question. The nurse is performing a postpartum assessment on a client who delivered 4 hours ago. The nurse notes a firm uterus at the umbilicus with heavy lochial flow. Which of the following nursing action is appropriate? 1, massage the uterus. 2, notify the obstetrician. 3, administer an oxytocin as ordered. Or 4, assist the client to the bathroom. Give me a second, guys. My throat's getting dry. And the correct answer is 2, notify the obstetrician. So let's talk about this. They just delivered 4 hours ago. The uterus is firm. It's firm at the umbilicus, and the patient's having heavy lochial flow. The patient's bleeding, but the fundus is firm. We're going to call the doctor. This patient's bleeding out. We got to find out what's going on with them. Now, let's look at the other choices, guys. 1, massage the uterus. For what? It's firm already, right? When do we massage the uterus? We massage it when it's boggy. And the reason we're massaging it is to cause uterine contractions to stop the bleeding or make sure the patient's not bleeding. But it's already firm. So we're not going to do that. That massaging is not going to do anything for the patient. That patient is bleeding despite that uterus being firm. Okay? Choice 3, administer an oxytocin as ordered. Why? The umbilicus is already firm, guys. We give that oxytocin to what? Cause uterine contractions so that uterus is not in atony. It's not boggy. Patient's not bleeding out. We're past that. That uterus is firm. There's no reason to give oxytocin, so that's wrong. And choice 4, assist the client to the bathroom. Why? It can't be due to a full bladder, right? Because if you go back to the question, look at what it says. Let me go back. It says that the uterus is where? It's firm and it's at the umbilicus. So the problem is not a full bladder. The problem is not a full bladder, and the problem is not that the uterus is boggy. Usually, patients bleeding postpartum, those are the two things we suspect, right? It's not one of these. You need to call the doctor. And that's why that's the correct answer, guys. Next question. A client's been receiving magnesium sulfate for severe preeclampsia for 12 hours. Her reflexes are 0 and the respiratory rate is 10. Which of the following situations could be a precipitating factor in these findings? 1, apical heart rate of 104. 2, urinary output of 240 cc's in 12 hours. 3, blood pressure of 160/20. Or 4, temperature of 100 degrees Fahrenheit. And guys, the correct answer is 2, urinary output of 240 cc's in 12 hours. Okay, why? Why, Professor D? What does the urine output have to do with this patient that's getting magnesium sulfate and the reflexes are 0? So there's a couple things you need to know here. Remember, what is a normal reflexes? 2. 0 to 1, those reflexes are hypo-reflexive. 3 and 4, they're what? Hyper, right? 2 is the perfect within normal range. This patient's at 0. So what does that tell us about the magnesium sulfate? That tells us that the patient's getting way too much magnesium sulfate. Okay. What does magnesium toxicity, what does too much magnesium sulfate, what does that have to do with the urine output? Well, look at the urine output. Urine output is supposed to be at a minimum 30 milliliters per hour for an adult. Okay, so go ahead and do that 30 times 12. Now look at what the patient has, 240. So the patient is not urinating as much as they should, which means they're doing what? Holding on to urine. And what? The medications. Think about it, guys. When a patient takes the medication, the liver metabolizes it, and your kidneys help you to do what? Excrete that medication. But if for whatever reason your kidney's not excreting the medication, that medication's staying in your system. And so that medication builds up. It builds up. It builds up. And before you know it, you have a toxic level of the medication in your system. In this case, we're talking about magnesium sulfate, and you know what magnesium sulfate does. It relaxes those smooth muscles, right? Well, now it's relaxing those muscles a little bit too well, and we got what? 0 in reflexes. 0. Remember, magnesium sulfate relaxes. Now the patient's relaxed a little bit too much. All right, guys. Next question. A client received general anesthesia during her C-section 4 hours ago. Which of the following postpartum nursing interventions is important for the nurse to make? 1, place the client flat in bed. 2, assess for dependent edema. 3, auscultate lung fields. Or 4, check patellar reflexes. And guys, the correct answer is 3, auscultate lung fields. Remember, guys, the patient just got anesthesia. Anesthesia puts a patient at a higher risk for getting respiratory complications such as atelectasis or pneumonia. So any patient that has had general anesthesia, it is very important to listen to those lung sounds. You want to hear clear lung sounds. Okay, now let's look at our wrong answer choices. Choice 1, place the client flat in bed. No, that client needs to be in the Sims position. Choice 2, assess for dependent edema. No need. General anesthesia doesn't put the patient at risk for edema. Choice 4, check patellar reflexes. If the lung sounds was not on the list, this would have been your next best answer. But airway is always first. So between checking reflexes and listening to lung sounds, we're going to listen to the lung sound. That's what's going to take priority. The nurse is developing a standard care plan for the post-C-section client. Which of the following should the nurse plan to implement? 1, maintain the client in left, a lateral recumbent position. 2, teach sitz bath use on second post-op day. 3, perform active range of motion exercises until ambulating. Or 4, assess central venous pressure during first post-op day. And guys, the correct answer is 3, perform active range of motion exercises until ambulating. Oh, sorry guys, I forgot to put okay. And here's why. Remember, I taught you that when a patient has surgery, I don't care what kind of surgery, I don't care if it's C-section, I don't care if it's removal of the gallbladder, whatever. If the patient had an invasive procedure, they are at risk for 3 things. Do you guys remember what those 3 things are? hemorrhage, infection, and a DVT or pulmonary embolism. So here we are, we had the patient who just had a C-section, which is a type of surgery. So we're going to be concerned about those three things. And it says here, let me go back to the question. Where were we? And it says choice 3, until ambulating. So absolutely, if that patient's not walking and we're already concerned about them getting a DVT, we're going to do range of motion exercises. We want them moving around, even if it's in the bed, to prevent them from getting a DVT. When you don't move, blood slows down. Blood slows down, blood starts to clot. Blood starts to clot, you have a problem. Okay, so that's why number 3 is the correct answer. We want to continue doing range of motion, keep that blood flowing to keep the patient from developing a deep vein thrombosis. Next question. The nurse has administered Benadryl to a post-C-section client who's experiencing side effects from parenteral morphine sulfate that was administered 30 minutes earlier. Which of the following actions should the nurse perform following administration of the drug? 1, monitor the urinary output hourly. 2, supervise while the woman holds her newborn. 3, position the woman slightly elevated on her left side. Or 4, ask any visitors to leave the room. And the correct answer, guys, is 2, supervise while the woman holds her newborn. Why? Think about Benadryl. What is Benadryl? It's an antihistamine. What is one of the major side effects? Drowsiness. So do you really want that mom holding her baby and falling asleep? What do you think is going to happen? She's going to drop the baby. So it's very important to supervise her while she's bonding with the baby. Remember, bonding is very important for the development of the child and for the relationship with the mother and the baby. So you're not going to stop them from bonding, but you're just going to be there to supervise to make sure that the baby is safe. Next question. The nurse should suspect puerperal infection when a client exhibits which of the following? 1, temperature of 100.2. 2, WBCs of 14,500. 3, diaphoresis during the night. Or 4, malodorous lochial discharge. And guys, the correct answer is 4, malodorous lochial discharge. So what is this puerperal infection? That purple word, guys, that's just a fancy word for postpartum. The patient has a postpartum infection. So of course, malodorous discharge, this kind of discharge, you better suspect infection. Now let's look at our other choices. 1, a temperature of 100.2. Guys, don't be fooled by this. Remember, up to 24 hours after mom gives birth, we expect to see the temperature rise, and that's okay. We're not 100% sure, but we think it has to do just with her hormones leveling out, right? So we expect to see that within the first 24 hours. Now, after 24 hours, we see the temperature going up, we're going to suspect infection, but within the first 24 hours, that is normal. So nothing's wrong with that. 2, WBC of 14,500. Again, that is normal for the postpartum patient because immediately after she gives birth, sometimes we see the WBC go all the way up to 25, but it's eventually going to come back down, okay? So nothing wrong with that. And then choice 3, diaphoresis during the night. That's very normal that we see in the postpartum patient, and it's going to cease on its own. What we would be concerned with is a true sign of postpartum infection, which would be a malodorous discharge. A rubella non-immune breastfeeding client has just received the rubella vaccine. Which of the following side effects should the nurse warn the client about? 1, the baby may develop a rash a week after the shot. 2, the baby may temporarily reject the breast milk. 3, the mother's milk supply may decrease precipitously. Or 4, the mother's joints may become painful and stiff. And guys, the correct answer is 3, the mother's joint may become painful and stiff. About 25% of postpartum patients will complain of this when they get this vaccine. Okay, about 25%, 1 in every 4. Now let's look at the wrong answer choices. 1, the baby may develop a rash a week after the shot. Well, why would the baby develop the rash when mom's the one who's getting the vaccine? Mom is the one who may develop a rash. Choice 2, the baby may temporarily reject the milk. No, that's not true. There's no evidence of that. 3, the mother's milk supply may decrease precipitously. That's not true. And the correct answer, guys, again, is number 4. The nurse should expect to observe which behavior in a 3-week multigravida postpartum client with postpartum depression? 1, feelings of infanticides. 2, difficulty with breastfeeding latch. 3, feelings of failure as a mother. Or 4, concerns about sibling jealousy. And guys, the correct answer is 3, feelings of failure as a mother. Guys, don't forget, depression, even though it's postpartum, it's still depression, right? It's a type of depression. Depression is just anger, hostility, resentment turned towards self. So I'm a failure. What's wrong with me? I can't do anything right, okay? It's them turning all of those negative feelings towards themselves. And there you go. Number 3. Now let's talk about the wrong answer choices. 1, feelings of infanticide. We see that more in what? Postpartum psychosis, where the mom is out of touch with reality. She thinks her baby is a she-devil and she wants to kill the baby, right? Choice 2, difficulty with breastfeeding latch. That has nothing to do with postpartum depression. Lots of moms who do not experience postpartum depression have difficulty getting the baby to latch. They're not, one doesn't affect the other. Choice 4, concerns about sibling jealousy. That also, guys, is not related to postpartum depression. Next question. Which symptom would the nurse expect to observe in a postpartum client with a vaginal hematoma? 1, pain. 2, bleeding. 3, warmth. Or 4, redness. And guys, the correct answer is 1, pain. So what we're talking about, vaginal hematoma. So guys, a hematoma, that is a collection of blood, okay? And that collection of blood is right under the skin. So what happens is the reason that the patient feels the pain is that collection of blood is pushing on the patient's nerves. And that's what they feel on pain. And when I say nerves, like I'm using the wrong word, not nerves. Pain receptors, there you go. That collection of blood is pushing on the pain receptors, and that's what's causing the patient the pain, okay? Choices 2, 3, and 4, these are not expected findings, but pain absolutely is an expected finding in the... Oops. Okay, guys, the breastfeeding woman calls a pediatric nurse with the following complaint. I woke up this morning with a terrible cold. I don't want my baby to get sick. Which kind of formula should I give the baby until I get better? Which of the following replies by the nurse is appropriate at this time? 1, any formula brand is satisfactory, but it is essential that it be mixed with water that has been boiled for at least 5 minutes. 2, don't forget to pump your breast every 3 hours while you're feeding the baby the prescribed formula. 3, the best way to keep your baby from getting sick is for you to keep breastfeeding him rather than switching to formula. Or 4, in addition to feeding the baby formula, you should wear a surgical face mask when you're around him. Guys, this is where your critical thinking comes in. I hope you all chose 3 because I want you to think about it. Even if mom switches baby to formula, isn't she still going to be bottle feeding the baby? Which means, isn't that baby still going to be in contact with her? So she might as well breastfeed the baby where the baby can get all of those antibodies and boost his or her immune system. Because even if she switches to a bottle, she's still feeding the baby, which means the baby's still going to be in direct contact with her. So she might as well give the baby those antibodies that come from her breast milk. The correct answer is 3, ladies and gentlemen. All right, guys, we are down to our last question. The nurse is discharging 4 Rh negative clients from the maternity unit. The nurse knows that further teaching is needed when the client who had which of the following deliveries asked why she didn't receive her ROGAM. 1, abortion at 10 weeks gestation. 2, fetal demise at 24 weeks gestation. 3, birth of Rh negative twins at 35 weeks gestation. Or 4, delivery of a 40-week gestation Rh positive baby. And guys, the correct answer is 3, birth of Rh negative twins at 35 weeks gestation. Remember, if mom is Rh negative, she doesn't need ROGAM unless the babies are what? Positive, because that's when we're worried about that reaction, right? But if mom's negative and the baby's negative, she does not have to worry about ROGAM, and that's why number 3 is the correct answer. Choice 1, 2, and 3, she definitely will need the ROGAM, okay? If mom's negative and she had an abortion, ROGAM. Fetal demise, ROGAM. Delivery of a RH baby, again, ROGAM. Guys, I'm sorry. If you felt like this video was rushed, guess what? It was. It absolutely was, because I've got to run. But I felt that you guys would rather me make this video in a rush than you not have it at all. So I hope you appreciate this video. Please let me know in the comments what you think about it. Please don't be too harsh on me, guys. We're family. Be nice. In the comments, let me know if there's anything else you'd like to see me cover that I haven't covered yet, or maybe I covered but you'd like me to go more in depth. Go ahead, let me know in the comments. I got lots of videos coming your way very soon. Please do not forget, check my website at nexusnursinginstitute.com. I have plenty of material and resources for you there. Don't forget to check me out on my other platforms: TikTok, Instagram, Facebook, and of course here, YouTube. Guys, thank you so much for sharing this time with me, and you'll see me on the next video.